cholesterol levels. This includes, the high triglycerides or, the LDL cholesterol, which is actually the bad cholesterol, which could be higher. All these puts you at risk for cardiovascular disease. Alcohol. So excessive alcohol intake or binge drinking definitely puts you at risk because alcohol gives you empty calories and that increases the risk of obesity, that causes your lipids to go haywire, and that puts you at risk for cardiac arrest. So if you drink, then do so in moderation. So I can see the big grin on many people's face, but again, you should know your limits. So there is a very thin line between doing so in moderation and going overboard. By moderation, it is 1 to 2 drinks per day per meal, or it is 1 drink per day for a female. And 1 drink is equivalent to 12 ounces of beer, 4 ounces of wine. Again, you should know your limits. Family history, because I see the big grin on my husband's face, so I'm just making sure that I drive into him that you should know the limits. Alright, and family history puts you at risk for cardiac disease or cardiac arrest. Alright, prevention. So, if you take care of the risk factors, you're going to prevent having a cardiac arrest. Again, exercise, healthy diet, healthy lifestyle, stress management. You had a lot of people talking about stress, healthy food, healthy diet. Stick on to it. Smoking cessation, this is very, very crucial, one of the most important modifiable risk factor. If I have at least one person who decides to quit smoking after this presentation, that would be, my best present for today. So blood pressure, cholesterol, diabetes management, if you take care of all these factors, then again, it decreases your risk. Oh, one other important thing is annual physical examination, which I wanted to reinforce, because many of us tend to overlook our health condition. So, let's say, I have had people who have had warning symptoms of chest pain, like exertional kind of pain, ongoing for like weeks to months before they land up having a catastrophic event and they get admitted to the hospital. So I'm mostly inpatient, so I see patients when they're acutely sick in the hospital, but they have had these warning symptoms for like weeks to months, which they just tend to ignore. So you know your body the best. If you feel that something is abnormal, you really have to go to your primary care doctor and get it checked out. Management of cardiac arrest. So the most important factor determining the outcome of cardiac arrest is early recognition and initiating CPR right away. CPR is gold standard. There is no way out of it. Let's say you find someone unresponsive, you tap them, they don't respond, check for the pulse, you don't feel it, initiate CPR right away. Call 911, but initiate CPR right away. Do not wait for the EMS or the first responders or anyone to arrive or to even tell you. Just pull them to a flat surface and start pounding on them. Because you can literally save someone's life. You can literally save the disability. Let's say you get a pulse in sometimes you run a code for like 20-30 minutes. Let's say you get it out. But if you haven't had CPR initiated in the first few minutes, few seconds, there is a lot of brain cell damage. So you could get them alive, but they will be a vegetable. So initiating CPR right away helps a long way in fruitful recovery. Alright, the next as important factor in cardiopulmonary resuscitation is defibrillation. So defibrillator, you shock the heart out of the abnormal rhythm. Nowadays you have these AED devices, automatic external defibrillator devices in major public areas. You take the devices out and you turn it on. That's the first step that you do. You turn it on. It will guide you through. It will tell you each and every step how to go about. You could be someone who has never seen a defibrillator in life, but if you turn it on, it will tell you where to put the pads on, whether to shock the rhythm or not, how to shock. It will guide you through each and every baby step. And the other, factors would be medications and getting them to the hospital on time and hypothermia. So what's the survival rate after cardiac arrest? So out of hospital cardiac arrest, which is the most common ones, which happen in the community, which is generally even not even witnessed by people, the survival rate is about 2 to 8%. In hospital, obviously, you have medical personnel right there helping you, so the survival rate in spite of that is just 15 to 20%. So survival rate following ingestion of toxins like drug overdose depends on early identification of what the person overdosed on. So family plays a very important role because they know what medications the patients have been taking, so they can play a very important role in identifying what could be the possible toxin, and giving an antidote at the right time can save the person's life. So overall survival following a cardiac arrest is about 6.8%. And women are more likely to survive the cardiac arrest and leave the hospital alive than men. All right, I think I have come to the end of my presentation, and the most important couple of points that I would like to insist and focus on today is, first is initiating CPR right away. I think we have the next speaker who is going to talk about CPR, how to perform CPR, but do not wait. If you see somebody unresponsive, don't feel a pulse, call 911 and start CPR. You will literally save someone's life and they'll be thankful to you forever. So do not wait for anything. If you are in doubt, just go ahead and do the CPR. If the patient wakes up, well and good. If not, at least you're trying to save their life. And the second important thing is quitting smoking. So these are the 2 points that I would like to really focus on today. All right, thanks for all your patience, and I'm really thankful I'm really thankful for Shakti to having given me this opportunity today.
Dr. Peter will take a couple of questions. Anyone with questions?
I guess I was thorough enough. All right, yeah, go ahead.
Can you do the CPR over there or here, like how you do that?
So we have the next person who's going to demonstrate CPR, the cardiopulmonary resuscitation. So you have I think they have a mannequin with him, so he's going to roll on. Yeah.
One more.
Sure.
You said palpate here?
Yeah.
What do you mean?
Oh, feeling for the pulse. I'm sorry. So palpate is when you touch something with your hands and trying to feel it. That is what is called as palpation. So I was trying to talk about feeling for the carotid pulse, which is right here. I guess if you have tried it, you guys actually can try it. It's pretty easy to feel that. It is one of the most bounding pulse that you have in your body. Okay, panic disorders, it can stress the heart. There is something called stress-induced cardiomyopathy. So what happens in panic attack is, there are a couple of things. One, it can stun the heart muscle. When you start panicking, you don't take in enough oxygen, the blood supply cuts down, you can stun the cardiac muscle, and it just stops pumping, and that can also, it's one of the causes for a heart attack. And as far as the other thing is, sometimes it causes coronary vasospasm. So what I mean by this is, when you get into a lot of anxiety issues, sometimes you have some spasm, like some stenosis. It's not like actual blockage, the vessels just shrink and there is decreased blood supply to the heart. That obviously can affect the contractility of the heart. Anxiety, I guess they just talked about the stress management. It's just part of anxiety. It's that's what it is for anxiety too.
One last question.
Hello, doctor.
Hi.
Suppose if you don't have any symptoms for heart disease and you go for a physical checkup, how can your physician help you, to to identify early risk of your heart disease, do you need to ask him to do something, or like I just wanna
Sure.
make sure that if I go for physical check, I know what to ask for?
Alright. So normally when they assess you, they talk about all the risk factors which we just mentioned. You know, that do you have diabetes, do you have high blood pressure, cholesterol? That's part and parcel of your routine blood check. You know, they would be checking your blood glucose. That's a part of your, blood work that they do. They will be checking the blood glucose, they will be checking your cholesterol levels. And smoking, family history, that's all a parcel of your history taking. If they feel that you are at risk, then at least they would start with an EKG. But let's say you have no risk factors and you have no symptoms, there is no point in, ordering an EKG, because EKG is only to substantiate what we are thinking or what we could do to help you. So just ordering an EKG without any symptoms is not going to be beneficial. But if you tell the physician that you have some risk factors and your chest is hurting, which is kind of abnormal, exertional kind of a pain, then 100%, 200% the physician would definitely get an EKG. And EKG is available in the office. You don't have to go to a different place to get the EKG done. It is available in all PCPS office. I'm sorry, I didn't hear you. What was it? Oh, you're welcome.
Thank you, Dr. Peter. Give us one moment, please. So that was a lot of information to take in today. In case you have not been able to register everything and you want to go back and look at something that she said, we have been telecasting live on Tamerica TV. Right now, it's on. And the video will also be available for you to look at on Shakti's Facebook page. Look us up and you can go back and look at the video again. If you missed any points, you can always go back, check back on any of the speakers. We'd like to do a little thank you for Dr. Peter. I'd like to call on stage Karamjeet Kaur and Dinesh Sharma. They're from New York Life Insurance and they're one of our sponsors. Thank you all. Now, if you're wondering why we have life insurance as one of our sponsors at today's health event, I'm getting to that. There's so many recent deaths in the community that we have been seeing on many of our groups. On social media, people putting out GoFundMes and support groups. Those are because people have not had life insurance connected to themselves. And a lot of these deaths are related to either heart disease or cardiac arrest or one of these. A little bit of planning would have really helped those families. Many of them have left behind spouses, families with no life insurance. That is why they're here. And if you're interested in getting a quote from their information booth, or if you want to know more, please meet them at the information booth after the session. They're also hiring financial advisors. So if you're interested in a job opening, talk to Jason Page at the information booth. Connecting from where Dr. Peter left us with CPR, we have our CPR specialist, William Michael Lipper. We're having some tech issues, I'm sorry. We're trying to get his video uploaded. He's going to run us through a video demonstration, and then he's going to take us through hands-on demonstration with his mannequin. The idea is not for us to get certified in CPR, it is for us to get a hang of what to do in an emergency. A lot of us really don't know how to do CPR, or it just looks so scary when you do a full-on CPR. When you look at the medics doing it, you're like, there's so much to it. But he's going to give us an easier way of, this is called a layman CPR demo, which is what he's going to take us through it. And I'm handing over the mic to Mike.
my friends with me. Well, Dr. Maria set it up very nicely. So if someone is in the audience and they collapse, they're unresponsive. You have 2 things to remember, 2 things only. She gave you 3. I'm going to make it really simple for you. So if someone becomes unresponsive, you shake them and ask if they're okay. Okay, that's not even the first step. But do that, because if they just passed out, they may come to. The next step is, number 1, call 911 immediately. So you have somebody call 911, or if you're by yourself, most of us have cell phones. You dial 911, put it on speakerphone, and then you go to step number 2, begin chest compressions. Okay, so what's step number 1?
911.
Call 911 or have someone else call 911. Step number 2 is chest compressions. And that's what we're going to do. I'm going to demonstrate for you. And those that want to practice, we have mannequins set up so you can actually practice. So to reiterate what I just went over, we're going to play a video. Okay? The video is going to step you through exactly what I just told you. I'm going to tell you again. And then I'm going to actually demonstrate on the mannequin, my friend I brought up. And then I will be through because you'll be trained. Now there's one other step that's important that Dr. Maria brought up, that we're in a public place, and I've already checked with Patrick. They have an AED in the building. So if I'm around, I'm going to say, call 911 and go get Patrick and tell him to bring the AED right now. What's the AED stand for?
Defibrillator.
Automated external defibrillator, right? Just like Dr. Maria says, somebody opens it up, somebody's doing chest compressions, the other person opens it up, turns it on, and it tells you exactly what to do. Very simply, very easily, the pads are even marked, you can't mess it up. It's impossible to mess that up. So, step number 1, call 911. Step number 2, chest compressions. No, I'll go over on stage. Thank you for asking. Yes, do you have audio? If you don't, I can talk through it, it's fine. That's okay. Rolling. Okay, so someone's unresponsive. Step number 1, call 911. And she asked if you're okay, you're okay. I would shake them. Step number 2, hand goes in the middle of the chest. Okay? Notice how she's pulling her fingers back. You pull your fingers back and have the palm on the chest. She has straight elbows or straight arms. She's compressing, so they'll tell you in the video, push hard and fast. If you want to be technical, you're going to push down for 1.5 to 2 inches. Okay? I'm going to show you and demonstrate, and you have a chance to practice good chest compressions. So you check to see if somebody's unresponsive. Okay? They're unresponsive, call 911. Position technique number 2, chest compressions. Okay? So here we go. I come up to my friend. Obviously, he's not in good shape. I think they'll be okay. Let me do it. I'll do it both ways. So I'm going to come up. I'm going to shake by the shoulders and say, "Are you okay? Are you okay?" Now, obviously, he's not okay. So what I'm going to do is, these are marked, so it makes it very easy in the middle of the chest. It's right in between the nipples. Palm of my hand goes in the middle of the chest. What you're going to see is I'm going to pull my fingers back, I'm going to have straight arms, and I'm going to do chest compressions. So here it goes. I've done this on TV live, mic'd up, so I think I can do it here. Okay, are you okay? You okay? Not okay? Call 911. I'm going to have you do it. Will you do that for me? She's on her way. Okay, here I go. I'm up. Now, how long do I do chest compressions? I didn't answer that question for you. How long do you do chest compressions? Okay.
Until you see more.
Until the ambulance arrives. That's correct. Until help arrives, and that would be the medics. Okay, Dr. Maria's here. If she shows up and she's going to say, I'm a physician, I know what to do. I'm not stopping chest compressions until I poop out, and then I will have her start chest compressions. She should know how to do them. Okay? But I'm going to only hand off to somebody that can do effective chest compressions.
No, but what if the person gets conscious?
Okay, you saved their life. Yeah, because again, we're making, that's a great question. The question was, what if the person I'm doing chest compressions on becomes conscious? Remember, we're making this very simple because, remember what Dr. Maria said? Within the first, how long does we start having problems with brain function? If they're lying there and the heart stops, it takes how long?
4 minutes.
4 seconds.
4 minutes. Well, if their blood's not circulating, I have news for you. It's going to be less than that. Okay. So there's already enough oxygen in blood. Your dollars are those people that contribute to the American Heart Association. This is the research that they're doing. What they found was, have any of you ever been certified in CPR or are certified in CPR, where you actually they did the airway, you open the airway, then you breathe them, then you do chest compressions? Well, what they found was, there's a 10-second delay where there's no air getting to the body, that it already starts affecting brain health. So there's already enough oxygen, especially if you go down right here and somebody witnesses that. There's enough air, oxygen in the body. If you would just circulate it, you have a 5 to 6 minute window to get help to restart their heart, where they can not only survive, but survive with brain function intact. Yes, ma'am.
If you don't have your elbows straight.
It just makes it really hard and really inefficient. So the question was, what if my elbows aren't straight? Well, what if my elbows aren't straight? I'm going to be doing this and not pumping the chest down. Okay, that's a great question. Thank you. Plus, it's really harder to do it that way. When the elbows are straight, my body weight takes my compressions down, and it makes it really efficient and effective. And I can do chest compressions. You could too, for a pretty long time if you have good technique. Thank you for asking. That's very important. Okay. Yes, sir.
Can I practice harder than it requires? Like you are pressing and it's more hard. Do I need to if it's a high person, they will start pumping more dangerous?
No, it is not. So the question is, a heavier person, a bigger person, is it harder? I can tell you from experience, it's much easier to do CPR chest compressions on a human being than a dummy, any dummy you'll practice on. It's much easier. As long as you get hand placement correct. Okay? The hand placement, if it's in the middle of the chest on that sternum, so right in between the breast, mid-sternum, heel goes down, as long as you're there, you'll have very effective compressions and it works very well.
So I should try as hard as I can?
Yes, hard and fast. Now, fast. In the video, what it told you that I didn't go over is it's going to tell you to the beat of, there's several songs, but the one that most people remember that works very well is the old Bee Gees song, Staying Alive. Okay? So it would be, so if I'm teaching it, here we go. Pattern my hand on the mic is the chest compression. That was extra. That was just bonus. That was bonus for those in front, right? So it's hard and fast to the beat of Staying Alive, which is going to get us over 100 compressions per minute.
100 per minute.
Okay? So let's review one more time, as if I haven't gone over it enough. This is so important. You don't have to be trained in CPR to know this and to do this. Somebody becomes unresponsive. We're going to shake them, ask if they're okay. Then we do number one. Number one is call 911, or have somebody call 911 that you know is responsible, that will call them and initiate the medic coming here, EMS coming here. Step number two, begin chest compressions. Okay? Palm in the middle of the chest, straight arms, pull the fingers back, and then we're going to go to the beat of Staying Alive, okay, which is going to be here. That's my presentation. Now, I know we have set up, I have 6 mannequins, and I know a lot of you, or some of you, have signed up for CPR to practice, and that's what we're going to do. We're actually going to, I'm going to step through the same steps again. We're going to do it together, and you have an opportunity to practice. You will be practicing on the table. So if you want to know more or see the correct technique and actually practice the correct technique, this is your opportunity to do so. This is the simplest thing you can learn to save lives, okay? Or at least give somebody a chance to survive if their heart stops. Okay? Thank you so much for having me. I look forward to many of you coming over and practicing.
Thank you, Mike. To give out our thank you memento to Mike, I would like to call Mrs. Shalini Soundarajan. Before we move on to the hands-on demonstrations at practice for you on the mannequins, I'd like to give you a couple of bits of information. We have feedback forms for the event on the table here. If you'd like to give us some feedback on this event, you can also leave feedback for us on our Facebook page. Go on, look for us on Facebook, Shakti. And you can also look for information on womenshakti.org. If you have already signed up for a CPR demonstration, or if you have not, if there are still some spots, please feel free to join him at the table right after Vimala talks to us. They say a woman needs to talk 35,000 words a day so she can be mentally healthy and happy. I guess I'm done with my 35,000, so here's Vimala for you. Vimala is on our board of directors for Shakti, and she's with you. Thank you.
Thank you so much, Priya. Okay. Good evening, everybody. Did you all enjoy today's session?
Yeah.
Yeah? Good. Okay. I don't think I can cover up 35,000 words as Priya said, but I'll try my best. Okay. Yeah. I deem it a great honor and privilege to propose the word of thanks on this memorable occasion on behalf of Shakti Corporation. Let me first of all start by giving glory to the Almighty God for making today's occasion a resounding success. First and foremost, I thank our special guest speakers, Tasia Lau from Clinical Ayurveda Specialist, Dr. Maria Peter from Karamont Regional Medical Center, Aruna Patki from Ayurveda Practitioner, William Michael Lippard, a clinical exercise physiologist from Novant Health, Lopa from Breast Cancer Hub, and Padmaja from Heartfulness Meditation, and Vijay Suresh, a yoga instructor at UNCC. I'm also very grateful to all the booth presenters. Thank you so much, you all. I would also like to express our sincere thanks to our sponsors. Without their generous contribution, this event could not have happened. So our sponsors are Bawarchi Indian Grill, Best Price Valentine and Moorswell, Sitara Authentic Indian Restaurant, R-Level Fort Mill, Karamjit Kaur and Dinesh Sharma from New York Life Insurance, Shalini Soundarajan, a realtor with Remax Executive, Lara Garcia from Aromatherapy, and we would also like to thank Agram Tamil Palli for sponsoring sound system for today. Yeah, and thank you so much for them. And I must mention our deep sense of appreciation to all our youth and adult volunteers. Without them, it may not be possible to have conduct an event like this. A big kudos goes to them. Please give a big round of applause to them. Thank you so much. Well, ladies and gentlemen, an event like this cannot happen overnight. The wheels start rolling weeks ago. It requires planning and a bird eye for details. We have been fortunate enough to be backed up by a team of very motivated and dedicated colleagues of Shakti Corp who knows their job and are result oriented. Thank you so much to all my fellow colleagues from Shakti Corp. And last but not least, I cannot thank everyone enough for all the attendees who decided to attend this event in spite of all your busy schedules today. Thank you so much you all for being patient with us and spending your time with us. Once again, I thank you all for your attention. Have a good evening.
Okay, I'm not going to drop the mic, but I'm going to drop you all with mic. Have a good evening. Thank you all.